So it was the 5th of November 2019 when I had my stroke. The night before I went to bed absolutely fine, had a good night's sleep, but I woke up at 6 a.m, really felt groggy. I went to turn the alarm off about 6:30 and just collapsed out of bed and ended up laying on the floor, not knowing what happened. I couldn't move my arm or leg. I was trying to speak and communicate with my wife, but I was clearly making no sense. She rushed out of bed and realised that something serious had happened, and she dialed 999 immediately to call for an ambulance. At this point my daughter came into our room and they both struggled to get me back on the bed where I stayed until the ambulance turned up. So the paramedics turned up after about 20 minutes and they very quickly realised it was a stroke and took me straight into accident and emergency at Peterborough City Hospital. I think the consultants there knew it was a stroke. They were under no doubt. And I think they had very early conversations with the University Hospital in Cambridge, a specialist stroke centre. So I had a couple of scans confirmed as a stroke, and then it was about what the right treatment and procedure would be to help me.
So when we first saw Paul, he came to this hospital having an acute stroke. He couldn't move the right side of his body and he couldn't speak. He was suffering from something called an expressive dysphasia, which means that he knew the words that he wanted to say, but he just couldn't get them out because of the artery that was blocking the blood supply to his brain.
The doctors in Peterborough didn't want to give me thrombolysis because they didn't really know what time I had my stroke that morning. But the very early conversations between them and the specialists in Cambridge were that I might be a suitable candidate for thrombectomy.
So when we did all the imaging for Paul, we did a CT head scan and a CT angiogram. The CT head showed that the brain looked okay, but the CT angiogram showed that quite a large artery was blocked. Now, when you have a large artery that's blocked, the two treatments available are to give IV thrombolysis, which means to give a clot-busting drug directly into the vein, or to do a thrombectomy, which means to go up and directly pull out the clot. Now, we knew that the thrombolysis, although that would be easier to give, was unlikely to be successful with such a large artery occlusion. So therefore, we thought thrombectomy had the best chance of good recovery. When we do a thrombectomy, we need to pass a small catheter directly into the brain blood vessel, hold on to the clot using a thrombectomy device, and then pull it out. Now, most patients can actually tolerate that reasonably well. And so most patients, we can actually do this under local anesthesia. So we just numb the skin above the artery that we need to go into, and then we do everything under local anesthesia. Now, some patients are a bit more confused and disorientated, quite reasonably so. So some people require sedation, and some people are in such a bad condition that we need to give them a general anesthetic so that they're fully asleep and ventilated. We use a mechanical ventilation to actually keep them breathing, so we can do this procedure. In Paul's case, we could do it under local anesthetic.
The procedure itself was really quite surreal. I was conscious and I knew what was going on, and it was really quite strange because my head wasn't strapped down, but you knew that something quite sensitive was going on through your body as the catheter made its way up through your heart, and you could feel a bit of a tingling sensation as it passed through my back of my head. I felt a tingling sensation. So it was really strange experience. And then immediately after the thrombectomy, I actually felt worse than I did just before it because of the trauma of the procedure. But thankfully over the next 24 hours, that really reduced, such that the doctors were happy for me to be discharged after 24 hours. So I came home. But then after a few weeks, I really got hit by anxiety, about nervousness about having another stroke, near-on panic attacks. So I had to come to terms with that. And then over the course of the next few months, actually, once I had a positive sort of conversation with a stroke consultant after my procedure, I got that anxiety under control and could focus on my recovery, getting back to doing normal things, working out, what my new brain was capable of, what it struggled with, driving again, doing, going out with the family, eventually going back to work after about 2 months. And then, two and a bit years later, here I am today talking to you. Most people wouldn't realise I've had a stroke.
Before we had the capability of doing thrombectomy, we had no way of treating such patients. We knew that the IV lysis would have a very low chance of success, and so these patients would go on to have a disability, which would sometimes be something that would last for all of their life. It could sometimes even be fatal. It could be the cause of their death. By doing thrombectomy, we have dramatically reduced the amount of disability that people suffer from. And before this, we just didn't have that option.
I'm still starting to do things, new experiences, ticking off the milestones that I would have taken for granted before my stroke. Obviously, the pandemic has put a bit of a curtailment on some of that. So, I'm yet to go abroad, for example. That's one thing I want to do again, go traveling independently, just so I can get my confidence that I can do that type of thing again. But I'm really, really grateful that I can hopefully give back by engaging with other stroke survivors, raising awareness, and hopefully thrombectomy can become more accessible procedure to more people, and more people can have a very similar outcome to me.
I think the biggest thing is that people need to realise that there is a treatment for stroke, and they need to come into hospital quickly so that that treatment can be applied and be most effective. I would encourage people to look up the FAST test online and see exactly how they could find out if someone is having a stroke. It's often that the person that's having the stroke themselves can't present to a hospital. They can be confused, they may be temporarily disabled, and so they rely very much on friends, family, bystanders to realise that they're having a stroke and pick up the phone, call an ambulance, and then everything can take place in terms of treatment.
So a key learning point for me is that strokes don't just happen to people in later life. Quite a lot of younger people have strokes, and I still don't know the reason for my stroke. I haven't got classic sort of risk signs, so they can happen. So I'd urge people, even if there are subtle signs, to play cautiously and ring 999, because that could buy you the time to come out the other side in a good place, rather than one that has been severely affected by stroke.